All right, Lisa, if you're ready, we'll get started. Lisa, I'm happy to introduce Lisa. She's a colleague of mine and is a public health nurse with the Grey Bruce Health Unit. She's been working with the health unit for 18 years now. Lisa has worked in many different departments, but is currently working with the population health team, focusing on the social determinants of health and building community capacity to reduce health inequities. She'll be speaking to climate change and health equity using a local tool to support action. Thank you for speaking, Lisa. Go ahead.
Thank you, Laura, and thanks to the Healthy Communities Partnership for organizing this great event. Just can you give me a thumbs up that you can hear me okay? Great. All right. So I was just reflecting the presentations and the wealth of knowledge shared today has just been tremendous. So my head is full, but I am delighted to have an opportunity today to share a tool that was developed by local partners in efforts to advance health equity in our communities. So I am going to just take a minute and pull up my, share my screen. See if I can do this here. That's great. Laura, can you just confirm you can still hear me? Because I can't see you.
I can hear you. I'm not seeing the presentation at the moment.
Okay. Let's try this.
Oh, that's looking better. There you go.
Better? Okay, yep. That's great. So I also just want to quickly introduce Jill Umbuck, coordinator of the Bruce Grey Poverty Task Force. As I know she's listening in today, I've seen her comments, and Jill has been a leader in health equity. She's a mentor for me, and she has contributed to this project since the very beginning. So I'm really glad you're here with me virtually today, Jill. I thank you always for your support. Okay, so before I introduce the health equity tool, I just wanted to take a quick minute to review the definition of health equity. Health equity means that all people, and this includes individuals, our populations, and our communities, have a fair chance to reach their full health potential and are not disadvantaged by social, economic, and environmental conditions. So this here is an illustration that is probably familiar to most of you. It's been consistently used to demonstrate how equity differs from equality. It shows that with equality, everyone is treated the same, regardless of their needs or circumstances. However, treating everyone equally doesn't mean that every person has the same opportunity. As we know, some people in our communities face barriers and require more supports and more resources to achieve the same level of health as others. So as an example, some people may suffer from conditions such as hay fever or asthma, conditions that can be exacerbated by more intense and prolonged pollen seasons. However, for some, the cost of medications to manage these conditions may be unaffordable, or perhaps they face barriers to accessing healthcare services. So everyone should have the opportunity to reach an optimal health line. And in this illustration, we look to the apples for that health line. And in order for this to happen, we need an equitable approach, which involves understanding and giving people what they need so that they're able to reach higher levels of health. So we have to think about the boxes that the people are standing on as resources, approaches, policies, and practices that have an impact on the conditions in which people live. So health equity is very relevant to climate change, as the relationship between climate change, health, and health equity continues to be well documented, including the many implications climate change has for health equity. So here is a picture of the health equity tool, Grey Bruce Health Equity Tool. Development of this tool started in 2017 as a result of a collaborative action group of the Bruce Grey Poverty Task Force called Moving Health Equity Forward. The action group works to advance health equity by implementing strategies to reduce the negative impacts of social determinants of health that contribute to health inequities. Several community partners from a variety of sectors were involved in the creation of this tool, and key components of the health equity tool were identified as a result of focus groups, research, and local data. So the action group saw this tool as an opportunity for service providers, organizations, and advocacy groups to really inform discussions about health equity and the impacts of social determinants of health on vulnerable populations. We also recognized at the time that many organizations were being required to implement health equity approaches into program and service planning in order to provide quality care and improve health outcomes. So when you hold this tool, or we often refer to it as a wheel, when you hold it in your hand, you can actually turn the sections around, and I did bring one with me, so I could kind of show you through video how it moves around. It's very interactive, and it really shows you how some of the populations, the social determinants of health, and structural components of health equity really intersect with each other to impact health. Not all the determinants of health or vulnerable populations are represented on the tool. However, that still presents an opportunity for discussion when using the tool and having it in hand. So the tool is available in hard copy. We still have quite a few copies left of the tool, but it is also an interactive online tool. And online, there's much more content, resources, and local supports. So we're really encouraging people to use the online tool. There are also 3 online training videos that introduces the viewer to health equity and outlines how to use the tool in professional practice, whether it is applying a health equity lens at the individual level or more at that systems level. The focus of the project for the past 2 years has really been on dissemination and implementation of the tool within our communities. And you can find the tool and the training videos on the Grey Bruce Health Unit website under Your Environment, Healthy Communities. So service providers, organizations, and advocacy groups can use the tool and the training videos, as I mentioned, to really engage in conversations about the many factors that influence health. I would say this is the primary use of the tool, is really to inform and facilitate those discussions about the vulnerable populations that we work with and the work that we do in regards to social determinants of health and health equity. But the tool can also be used to orient new staff or to use in professional development related to health equity, to advocate for policy changes that might improve the health of individuals, to support program or service planning while considering the needs of vulnerable populations, and to explore the relationships between social determinants of health, populations, and local data. So we often refer to the social determinants of health to understand those root causes that affect health. Although our health is influenced by so many factors, including healthcare, our genetics, environments, and our lifestyle behaviors, we do know that the social determinants of health, such as income, housing, and food, have the strongest influence over our health. And climate change also puts health at a direct risk by affecting or impacting the social determinants of health. So let's think about how this tool may be used in the context of climate change. And I thought we would start with the middle section of the tool that identifies just a few of the social determinants of health. So if we look at money, for an example, our income determines our living conditions and access to safe housing and the neighborhoods we live in. Families living with low income may have no other option but to live in substandard housing in areas with poor air quality and perhaps without access to air conditioning. These conditions may increase exposure to climate-related hazards and the risk of injury during an extreme weather event. It also reduces the ability to access and afford recovery efforts from an extreme weather event. If we look at employment as another example, not only does employment contribute to our income, but depending on the job and the type of work, one's physical, mental, and social health may be impacted when working in unsafe or stressful working conditions. So newcomers or immigrants may have difficulty finding suitable employment and therefore are more likely to accept work that includes strenuous physical labor or outdoor work. This type of work we know can increase the risk of adverse health effects from either high temperatures or perhaps air pollution. If we think about our physical environments as a social determinant of health, although newcomers or immigrants face many vulnerabilities, they are also very resilient, as many know how to garden, cook, and preserve food, which can really help to mitigate food insecurity. So these are just a couple really brief examples, but there is a great deal of literature that I had found identifying how climate change affects each social determinant of health, putting vulnerable populations at increased risk of health harms. So who is impacted by climate change? Well, we know that climate change can harm the health of everyone, but we also know that the health effects have a disproportionate impact on disadvantaged populations, often exacerbating inequities that already exist. So the outer part of the tool identifies some of the vulnerable populations who are at increased risk of being affected by the anticipated effects of climate change. Perhaps you work with some of these populations who are already experiencing health inequities or complex health needs. So just to highlight a few examples, those who are socially and economically disadvantaged. So on the wheel, this could include populations such as people with low income, people with disabilities, or ethnocultural groups. If we look at older adults, we know that older adults are often on a fixed income, making it more difficult to meet the costs associated with natural disasters. In terms of the health effects, aging impacts the ability to regulate body temperature, and older adults are at an increased risk of heat-related illnesses and death. Children is another population group who may be more exposed to environmental hazards, as they tend to spend more time outdoors and their immune systems are not fully developed. Young people who witness gradual but noticeable changes to their environment may experience fears, worry, stress, anxiety, and frustration about climate change. Furthermore, climate-related stress has shown to have long-term negative impacts on children's health, their intellectual development, language performance, and emotional regulation. The good news is that we're seeing where more and more children and youth are becoming leaders for climate change and really advocating for change in their own communities. So this chart provides a visual of some of the connections, and just to highlight a few, some of the connections between climate change and what impacts our health, such as extreme temperatures, those extreme weather risks or events, natural hazards, air quality. And as a result of these health impacts, there are health-related effects for many people, as I mentioned, especially those who are already impacted by the social determinants of health or the conditions in which we are born, grow, live, learn, and age. Another health-related effect of climate change that isn't on this slide, but I think is really important to note, is sleep disturbances and poor mental health, which can be aggravated by exposure to stress. And I know from the presentations this morning, both Dr. Klinsky and Dr. Feltmate referred to this level of stress and psychosocial stress and the negative impacts of mental health related to climate change events. So when we are stressed, we often kind of lean on our social support networks to really help us deal with such challenging events and circumstances. But when I think about the many groups of people who do not have such networks or social supports, it can, of course, put them at an increased risk of experiencing social isolation and loneliness. So again, those are just a couple examples to highlight. If we refer back to the very first slide on what health equity means, I think it's really important that we ask ourselves, how can we provide an equitable approach? How can we make sure everyone has what they need in order to achieve higher levels of health and less impact on health? What are the resources, the approaches, and the policies that can be implemented to really mitigate the negative health impacts of the social determinants of health? And I think, again, Dr. Feltmate this morning highlighted some really great work that's being done in terms of protection guidelines and working with insurers, builders, and financial people to help mitigate some of these risks of extreme weather events. And he also made some really good recommendations for approaches and policies for right here in Grey Bruce. So that was really exciting to hear. So what actions can we take to address climate change and improve health equity? Well, these 4 roles are outlined in a document called Centering Equity in Emerging Public Health Responses to Climate Change from the National Collaborating Center for Determinants of Health. These 4 actions align with the required approaches that are already being implemented here at Public Health for health equity, but they are also relevant to any sector focusing on health equity planning related to climate change. So just to go through each of them briefly, the first role to assess and report on climate change impacts and health inequities. This refers to utilizing assessment and surveillance tools for health equity in order to collect data and communicate the impacts of climate change with an equity lens. So for example, tracking deaths caused by extreme heat among individuals living in low-income neighborhoods, or perhaps looking at mental health impacts of climate change among socially disadvantaged populations. With the online tool, there is a link under each, most of the populations, there is a link that takes you to census report data for Grey Bruce region. So it's a really great data source if you're interested in looking at some of our local indicators such as income, housing, employment, ethnocultural, and Aboriginal identity within each municipality. So again, you can find those links online. The second role is to modify and orient mitigation and adaptation activities to reduce health inequities. So how do we incorporate health equity into planning? And how do we adapt our actions or our activities to reduce inequities and to try and mitigate some of those negative impacts? So for example, considering health literacy and people's ability to understand information when we're communicating the risks of an extreme weather event, or taking into consideration which communities would benefit the most from greening initiatives. Another important consideration is to engage people with lived experiences in these planning processes in order to understand their unique needs, histories, cultures, and capacities. Looking at role 3, to partner and seek opportunities for multi-sectorial collaboration. Are there opportunities to contribute to municipal plans for climate resilient communities? And how can we advocate collaboratively to improve the social and economic conditions within our communities? And lastly, role 4, to participate in policy development. We can advocate for policies that reduce health inequities and contribute to climate resilient communities, such as active transportation, connected trails, safer intersections. But when policies are proposed, it's really important to assess the potential impacts on populations. There's a really great tool that was developed by the Ministry of Health and Long-Term Care called the Health Equity Impact Assessment. It has been around for some time now, but we continue to use it as it is a tool to help planners and decision makers when developing policies, programs, or initiatives. And the tool really helps us to identify populations who are at an increased risk, as well as any potential impacts, whether it's a negative impact or a positive impact, and what strategies can we consider to help mitigate those impacts. So if you'd like more information, again, on the online tool, there is a link to the Health Equity Impact Assessment tool. So just when I was thinking about this slide, and again, just reflecting about the entire day today, it's been really encouraging and really inspiring to read all of the comments and suggestions in the chat box, and to really hear all the presentations today, because there has been so much collaborating already through this virtual event in terms of supporting our work, and how do we move forward, and how do we implement the policies and really advocate as a collective group. So I think there's lots of opportunity ahead of us for sure, and lots of great work already being done. So in closing, here are a few questions that may help to guide you when using the health equity tool in your discussions and your planning. So how does climate change interact with the determinants of health? And who are the populations at higher risk? What are the health impacts and the related health effects? What mitigation strategies may help us to reduce the negative impacts? And what opportunities do we have to adapt to climate change in order to protect our own health and that of vulnerable populations? So for the past 15 minutes or so, I've explored some of these questions in very brief context, while others are there for future discussion. But certainly Dr. Klinsky, again this morning, referred to the impact on vulnerable populations and the health effects, and how important it is for us to tackle these underlying vulnerabilities for so many people. So for many people in our communities, the chances of living a long and healthy life can really seem like a rigged lottery or a stacked deck. Not just because someone is living with a condition or a chronic disease, but because of the impacts of the social determinants of health. And the social determinants of health become a much bigger priority when you consider the impacts of climate change. So to achieve health equity, we must tackle these inequities that are unsystematic, unfair, and avoidable, the ones caused by social, economic, and environmental conditions. Working towards health equity means we pay closer attention to the people in our community who face such barriers and challenges to achieving healthier outcomes. We need to ensure a healthy standard of living for everyone. And as influencers in our community, we all and for your input, if you want as I said, it's a colorful tool, and we're really hoping to continue our work with disseminating and implementing the tool in our communities. We do have an evaluation to
Okay. Yep, we just lost Lisa. That's okay. She got through most of her presentation, which is great. And you know what? I work on the health equity portfolio as well, so I'll try to answer a couple questions while she hopefully tries to reconnect. So I can see that we have one question about, should our response to climate change be similar to our COVID-19 response? I think there's a few elements that definitely cross over. I definitely think that what we need to do is recognize both climate change and COVID as broad sector problems and respond accordingly. So the way that our communities have really stepped forward to respond to COVID-19 is the same level of response that we need to make climate change responses effective. I'm just going to fill in as I can for Lisa. Let's see, what else do we have? I think that's a great comment about climate change adaptation, potentially counteracting mitigation strategies. It's certainly something that we have to look at, and I think it's especially relevant to groups that are more vulnerable, because some of the adaptation responses available to them may not be as far upstream and maybe more likely to counteract some of the mitigation strategies. Increasing capacity. That's a great, I have no idea what is currently being done for older populations to increase their access to different programs for learning about online tools and different software. I'm quite sure that they exist. There's Lisa. Do you want to come and join? I'll let Lisa take over. But I do think there's definitely room for that. Just a second. Okay, I'm going to put you on. You can take my spot.
Where are we at?
Question. So I tried to answer the question about whether should our response to climate change be similar to our response?
Okay, I'm hoping everyone can hear me. I apologize, for some reason my computer just froze up and was circling, but luckily Laura was very close by. So I haven't had a chance to kind of look at the chat box here, but it looks like there are a couple questions. Should our response to climate change be similar to our COVID-19 response? That's a really good question, for sure. And I know here at the health unit, our team has been, as I mentioned, a health equity impact assessment tool. We have been using that HEA tool to really look at how public health measures that have been implemented as a result of COVID-19, because we know there have been a lot of public health measures and protocols, but how those measures have impacted vulnerable populations in our communities. And I certainly can see very similar responses, you know, as many people, you know, those vulnerable groups have been impacted tremendously by COVID-19, as well as I mentioned, through climate change. So I certainly think there could be a very similar response to that. Okay, and Laura just suggested, since we are a small group, if anybody would like to unmute and chat, that would be okay. And we have about 2 minutes.
Hi.
Hello.
My question was regarding increasing the capacity of vulnerable populations such as seniors so that they can access information online. For example, I need a washing machine. How do I go about that?
So there were a couple questions.
Yeah, so that's certainly a challenge. We do know that technology has been a barrier for a lot of people in our community, especially for older adults and seniors, for sure. So I think that is one of the barriers that we need to look at in terms of how do we mitigate that negative impact for so many people in our community. Yes, I agree. Technology can be difficult, especially during a pandemic when we're asking people to refer to their computers and you know, to order things and to access their needs, basic needs.
Well, that's excellent.
I have a question.
Yes, hello.
Hi, I'm Joachim. I'm wondering, I think it's a very complex one that most of the discussion when it comes to health and climate change have to do with adaptation and connecting climate change and health and mitigation is a much more complex one. Do you have any thoughts around that, how to address climate change and health from a mitigation point of view?
I'm struggling to answer off the top of my head, and I apologize, but I'm hearing multiple voices beside me, and I'm having a difficult time kind of concentrating. But I think that's a really good question, and I don't have kind of an answer off the top of my head, so I apologize, and I'm not sure if anybody else wants to chime in. Please feel free. I do think, you know, in terms of when we're looking at mitigation strategies, completing or working collectively to do a health equity impact assessment. Again, we have used that tool in our programming when we're planning initiatives or activities to really help us to identify and really brainstorm who are the populations at increased risk and what are some of those impacts and how can we come up with different strategies for mitigation. And it certainly has been a helpful tool to help us move forward in some of those strategies.
We'll follow through the last two pieces of the day, and we're going to start that in about 2 minutes.
Yep.
Thank you very much.
Not that I can hear.
All right. Thank you, Lisa, and for making the quick dash back to this room. That was great. I appreciate it. So we're just wrapping up for this session.